These are not legally binding insurance contracts, and there is no guarantee your bills will be paid. And so that's something you've got to be aware of. And if you don't have significant assets, this may not be a good option. So, welcome to the Millionaire Insider Podcast, formerly the Wealth Inside and Out podcast, where we help you create a confident, secure retirement and life you love. I'm Annette Bau, certified financial planner and founder of the Millionaire Insider. For over 36 years, I've helped pre-retirees and retirees turn their paychecks into guaranteed income, reduce unnecessary risk, protect their legacy, and design a retirement filled with purpose and freedom. Because true wealth isn't just about money, it's about confidence, clarity, and control over your future. Today's free resource is our retirement readiness quiz. You can go to themillionaireinsider.com/RRQ and take the quiz. But this quiz is going to really give you an assessment of where you are as far as the different stages to prepare for retirement. It is really insightful, and you can access it at themillionaireinsider.com/RRQ. It's going to give you insight to either stay on track to what you're doing or to create a better plan so you can get on track. For today's show notes, you can go to themillionaireinsider.com/158. The Millionaire Insider copyrights all materials and intellectual property. This information is for educational purposes only. It is not intended to replace any advisor or specialist or to provide any investment, financial, tax, retirement planning, or healthcare advice. By accessing this content, you agree to hold the Millionaire Insider and its affiliates harmless for results achieved or not achieved. So let's dive into, is a medical sharing program a solution for rising healthcare costs? So let's face it. I mean, healthcare costs by most standards are out of control in the United States, and there is no end in sight. It's a concern for so many, especially those nearing retirement. Many describe it as one of the biggest financial stressors other than running out of money in retirement. So it's a problem. About 20 years ago, when my husband left his 30-year career where we had our insurance and he joined me, our insurance cost was literally $44,000 a year with premiums and deductible before anything paid. And so I started looking at options. I had never been open to a sharing program. And I was a little reluctant, but I had so many people sharing how much they loved it. One of my friends is like the top salesperson for a sharing program. And I just got a little interested in looking at it. We're a pretty healthy family, so it seemed like it worked on that front. Obviously, if you're not super healthy, it might not be a great option. But I started looking around and I chose one. The premium started at about $400 or $500 a month. They're now at about $700 a month. So, you've got almost $10,000 a year that you're paying in premiums. And then our deductible is $10,500. So it's still not cheap. I mean, it's almost $20,000 a year. A lot of people have asked me what I thought or if I would recommend a medical sharing program. And I wasn't really in a position to share any insight because I'd never really had any claims processed through them because I never met my deductible. But last year that all changed when I broke my leg skiing. $90,000 later in medical bills. I only stayed at the hospital for 3 nights and they told me I was going to be there another 5 to 7 nights. But, you have no sleep and food that could kill somebody. I'm like, I have to leave. Thank goodness I was able to leave. And it was unfortunate because I was 2 hours north, one of my other homes is. And so getting down to Phoenix was a little bit of an ordeal, but I got down and thank goodness I was able to start sleeping and eating well. And I know that really helped with my recovery. What I wanted to share with you is some of the good and bad now that I have more information as far as sharing programs so that you can make a more informed decision on what may work for you and your family. The first thing is you got to understand the options. I mean, that's essential. One of the things that you need to understand is kind of what is a sharing program and how does it work. A medical sharing program, also referred to as a health care sharing ministry, is not insurance. It's a community-based arrangement in which members contribute money each month to help cover one another's medical expenses. Some of the programs are faith-based and other ones are more broadly structured. So you have to look at what will work for you. And so I've known people that have used a lot of different ones and have had good results. I've not really had anyone that's had really bad results. So Again, you got to look at it and make sure it's right for you. And as in any financial decision, before you make a final decision, I encourage you to consult with a qualified financial advisor who's a fiduciary. That just goes without saying. If you haven't heard me say it before, I'm saying it again. So, how do they work? Well, the first thing is people that are in the program make a monthly contribution. It's not a premium, and you have to pay a fixed monthly amount. It often is lower than insurance premiums. And this goes towards a shared pool or it is directed to other members. And the sharing entity makes those decisions. The next thing is there's a medical needs submission. When you have a medical expense, you submit it to the program and it has to meet the program's eligibility guidelines. Now, I learned this the hard way last year because I had an eye procedure and the facility that did it didn't accept my sharing. So, what we agreed to is I was just going to pay cash and then I'd submit it after the fact. Well, make a long story short, this facility automatically, when you pay cash, codes the medical expense as elective, not medically necessary, even though the procedure on my eye was medically necessary. So right now I'm arguing with them that they got to give me a bill that shows it's medically necessary. My eyelid wasn't completely closing. So it was a problem, right? I'm like, if I'm at least going to have something done on my face, I want to make sure that, and I'm having to pay for it, I want to make sure that it's going to make me look better. Make a long story short, it was medically necessary. So right now we're in the discussions of that. Those are some of the tricky things. Like I had no idea that when they then gave me a bill to submit, that it would say electable. So all those expenses were excluded. So you just got to be aware of that. All right, the next thing is cost sharing. So other members are contributing to help pay your bills. Sometimes payments are sent directly from other members. I know that one of my advisors that's on a sharing program, her husband had open heart surgery. Their deductible was $5,000, got that covered, but then they started getting checks from people. So I don't know exactly how that works. I just know in her case, she started getting checks. I haven't gotten any checks. I'm not sure if it's on a need basis or what. And then there's a personal responsibility amount known as a PRA. And this is similar to a deductible. You pay a certain amount of out of pocket before the sharing begins. Mine is $10,500. And I think there's only one lower that's like 10,000. So it's a high deductible. You have to factor that in if you're considering a program like this. So let's talk about some of the pros of a medical sharing program. One is possible lower monthly cost. Sometimes it's cheaper than traditional health insurance. It can be very appealing if you're healthy. Now, one of my clients recently tried to get access to a medical sharing program and he couldn't because he's had cancer in the past. So they are really strict that you don't have pre-existing conditions. There is some flexibility, meaning freedom in choosing providers, but they're pretty strict on the networks. And there's various ones that don't include it now because I broke my leg skiing and it happened to be on Thanksgiving weekend and there was literally no one available. Like the guy that rescued me was like the number one rescuer on the hill and he's had several accidents and he's like, this is who I'd go to first. So I contacted them. They're like, we're out until Monday for the holiday weekend. So I went to a D1 facility. I mean, it was a very good medical facility, great doctors. I had great experience and did a great job. And so it all worked out well. I still don't know if they were in my network or not. When I went there, they said they were, but I do know that my network will cover out of network if it's an emergency or if there's not an option available within like 30 miles. So again, you got to check the fine print. You know, these are just things that like I'm finding out about now after umpteen years because I needed it. One of the advantages is that it's very community based and even faith based. And so members often feel a sense of connection and purpose. And some programs include personal notes, prayers, and even direct sharing. So there are some other advantages. Another one is lifestyle incentives. Many programs require or reward healthy behaviors. So, not excessive drinking, not smoking, just living a more healthy lifestyle, which I'm all about. Let's talk about some of the negatives possibly. And you got to be really careful, especially when it comes to your bigger picture plan. There is no guarantee of coverage. These are not legally binding insurance contract, and there is no guarantee your bills will be paid. And so that's something you've got to be aware of. And if you don't have significant assets, this may not be a good option. They don't cover pre-existing conditions. They often limit them or exclude them. And this can be a major issue for pre-retirees, especially if you have pre-existing conditions. They've got limited coverage as far as what they're going to cover for mental health, for preventative care. Mine doesn't cover any preventative care or any alternative therapies. Some cover maternity, others don't. So again, you've got to really look at it. There's no ACA protection, so it's not regulated like traditional insurance. There's no required essential health benefits, and there's no out-of-pocket maximum protections. All those things are absolutely important to understand and to factor in, especially if you don't have a significant amount of money. Now, if you've got deep pockets, that's a different story. But there is a large financial risk. You get cancer, surgery, they may not be fully covered. So you've got to be aware of that. I'm going to dive into numbers here in a minute so you can just get an idea. Because for me, staying in the hospital for 3 nights and really 3 days, because I got there late, on some tune of like $90,000. One real major advantage that I saw from dealing with them is, man, they negotiate like big time. Like they got a $71,747 hospital bill down to $16,449 they paid and like $1,049 I have to pay. I mean, it's incredible. Now, they were slow. It takes them 3 months. They must have tried to go after the ski resort because when I talked to the person, he said, oh, it was skiing. Yeah, we'll definitely go after the ski resort. And they should, because basically what happened is I went to stop and it was icy. All right. Okay. That's fine. But then there were just all these rocks and my ski hit a rock. And so my ski stopped and everything else kept going. So that is something that really could be deemed a problem for the ski resort, I would think, because that's something they could have controlled. Meaning they can't control necessarily the ice, but they most certainly can control having rocks on the ice. Whatever push came to shove, they end up paying $16,449. And it took a long time. And I had to follow up because it was 3 months and I'm getting a bill. First of all, I was getting a bill for the $71,000. Then they took 50% off. So then it was like $35,000. Now, one of the things, and I'll talk about this in a minute, but one of the things just to be aware if you end up finding yourself in that boat is the fact that they did offer a 36-month no interest payment where you could pay like $1,000 a month for 36 months. So that could have been an option if they didn't cover it. I've got all my numbers here and I want to share them with you so you can just get an idea. The total expenses for my tibia break was $86,993. I had to pay $10,500. But I want to go over some of these numbers. It was really interesting. So this is one thing you always want to do is you want to say, if I pay today, can I get a discount? Now you obviously have to have the money to do that. And hopefully you're not having to put on a credit card and not get money back. I put on a credit card and I pay that off. So, again, you got to look at it because then on my credit card, I'm getting like, 1 or 2 or 3% back or miles, which depending on which one I use. One bill, I think it was, I don't know what department it was for, but it was $194. And I'm like, oh, can I get a discount? Absolutely not. We don't give discounts. All right. So I paid that. The next one was $1,650. And I had just talked to the other one, like, oh, they probably don't give a discount. Well, do you give a discount? Oh, yeah. If you're paying, we can give you a 10% discount. Now, they don't tell you about it. You have to ask. So I only had to pay $1,485. Now, the next one was like godsend, $3,400. And so I was going to have to pay somewhere like $3,000. And I was going to have to pay, somewhere in the tune of around $3,000. But what ended up happening is because they don't accept my sharing program, they coded it as cash pay. So she goes, hey, listen here. They coded it as cash pay. So now the bill went down to $2,246. And with the 10% credit, I only had to pay 2021. So, I mean, we're talking a difference of a lot. What? $1,400. And it was just like, wow. And then there was another one that was 249, no discount. So again, just ask for it. I learned this with my children. My children played sports, as you may recall if you've been following me for a while. And both of them got injured. One, it was a soccer injury where my son's leg hit another kid's head and I heard it. Oh my God, it was terrible. And all I know is he had to be carried off the field. He's screaming. We go to the emergency room. They take an x ray and give him a Tylenol. He didn't break anything. I mean, it's unbelievable. And sent him home and said, don't play soccer for 2 weeks. I tell this story that we're in finals, right? And obviously my son was a critical player. And I get there the next day and I'm walking out and I'm like, why is our son playing soccer? He was just at the ER yesterday. My husband, they really needed him. I'm like, oh my God. Oh, he was fine. So a Tylenol and an x-ray, we get a bill for I was like, I want to say it was like $4,000. It was ridiculous. And I'm like, wow. So my other son played baseball. He gets hit with like an 80-mile-an-hour ball in his back. We were playing like 3 or 4 games. And so we went to the second one and this guy comes up to me and he goes, I saw your son get hit. And I go, yeah. And he goes, are you watching him? Yeah. And he goes, well, I just want to let you know, one of the other kids at another high school, same thing happened to him. And it hit him in the back and it actually ruptured his spleen and he almost died. So if your son starts showing any signs, you got to get him to an emergency room because it's really dangerous. Well, of course, I'm like panicking. And then by the next game, he's like, Mom, I don't think I can play. It's hurting so bad. So I'm like, we got to go to the emergency room. Fortunately, we were close to a children's hospital. So we went down to the children's hospital. We were there for 6 or 7 or 8 hours. They ran so many tests. He was fine. Boy, they had to have ran 20 tests. It was like one after another after another. I'm probably exaggerating, but it was a lot. We get that bill. It was the exact same amount as the other hospital, right? Around, I don't know, 4,000. So I call the first place that my first son went to and I said, do you get any discount if I pay cash? Nope, absolutely none. It is what it is. The only thing we'll give you is we'll split it over, like $100 a month for 40 months. All right. And I did it not because I couldn't afford it, but it's like, why not? Then you have that extra cash as long as, you are comfortable with it. But if they're not charging me interest, I was fine with that. If they would have charged interest, I would have just paid it off. Well, my other son, they're like, okay. And I go, well, if I pay it off today, do I get any discount? Yeah, you get 50%. I thought she said 15. I go, 50? Like 50? She's like, yeah. I'm like, where can I sign up? So save 50% on that. So simply asking, do you offer a discount can be really advantageous. Now, there's one other thing I want you to be aware of when it comes to medical expenses. So I have a colon condition. It's genetic. My sister has it too. And it's where we have polyps. Well, I have been having colonoscopies for over 20 years. And so I've got the procedure dialed in. My guy retired and finding somebody that's as qualified as him has been a little bit challenging. I finally found somebody who is qualified to take over my care. And so he has 2 options of hospitals. He does his in hospitals. Now, probably because maybe they see the condition as higher risk because you have polyps and just in case something happens. So the first time I scheduled at the same hospital that my son, that they wouldn't give any discount on, used. And the cost for that facility was almost $3,000. Okay. Then plus the cost of the doctor is like another $2,200. And then the anesthesia, which will be somewhere around $500 to $1,000. All right. So those are the numbers. Well, it turns out that the doctor had to cancel my colonoscopy. So it meant that I could go to a different hospital, which I would always choose over that first one. Well, I call them up and I'm like, okay, what's your cost? And they're like $1,500, basically half of what the other one was. Now, I just found this out yesterday. The cost of that procedure at the hospital was almost $36,000, but they have a package deal that you can pay $1,500 if they don't have to submit to insurance. So I'm like, oh, that's good to know. I didn't know that was the case. So if it would have gone through my sharing program, what would have happened is the 36,000, they would have taken 50% off, so it would have been about 18,000, and then the sharing and I have to determine how we would split that, and I would be liable obviously for my 10,500 if I hadn't met that. So, for me it's just easier to go and pay the 1,500. Once I pay that, I can still submit that and it'll count towards my deductible. And then the 2190, they are going to take off 50% for me paying it. So it ends up being 1,080. And I'm not sure what'll happen with the anesthesiologist. But the point being here is, I mean, you have medical expenses, they start adding up really quickly. And when I was looking at owing 72,000, because I'm like, well, what if the sharing program doesn't pay? I mean, that's a lot of money. I don't care how much money you have. So once it dropped down to 35,000, I felt a sense of relief. Once it dropped down to 1493, I felt really good. So that's the scoop on that. So let's go back and finish this up just a little bit with just a little more information on looking at healthcare costs and why it's so critical, especially as you approach your 50s and 60s. It's a big retirement risk. Medical costs often increase with age. Why? Because we have more health issues. One major health event can completely derail our retirement savings. And Medicare doesn't cover a lot of things, especially long term care. And now that they're going to start using AI on Medicare and they're going to reward states that decline people, it's terrifying. I've read this article, and like Arizona is one of the states. There's like 6 states are going to start testing it on, and it's not good, my friend. It's not good. And we've got to do what we can to stay healthy and to mitigate our risks in retirement. So, who might be a good candidate to consider a medical sharing program? Number one is really being healthy. You've got to be healthy and have minimal medical needs, looking for lower monthly costs, comfortable with higher financial risks, having the cash in the bank to pay. Meaning, I guarantee you, I wouldn't be getting all these discounts if I wasn't paying it. And so you got to be aware of that and then make sure that you're aligned with what the program's values are, whether it's more of a community based or a faith based. You want to make sure that you're aware of that and you're comfortable with it. So, who should be a little more cautious? Obviously, people who have pre existing. If you're approaching retirement and you don't have the resources to come up with 10,500, I'll probably be at 10,500 again this year. I'm going to be close and I'm going to try. I think I have to get my hardware removed because I have 7 screws and a plate, and 2 of the screws have just hurt all the time. So he's like, we'll probably have to remove it. So he said 1 year. So I'm going to try to get that done this year. So I'll get everything done I can this year so that I will meet the deductible. And then next year I don't have it. If you want predictable, guaranteed coverage, it might not be a good option. Or if you can't afford large, unexpected medical expenses, all those things are things to take into account. The bottom line is really that a medical sharing program may reduce monthly costs, but oftentimes it shifts the financial risk back to you, especially if you have healthcare problems. From a planning perspective, this is a key question. Are you saving money by doing it, or are you risking your retirement? You've got to look at that. And that's why I recommend you really consult with a qualified advisor who is a fiduciary. For many pre-retirees, the issue isn't just affordability today, it's certainty and protection for tomorrow. So you've got to look at that. So there you have it. Now, the one thing I just want to encourage you to do is that whenever you're looking at any change, is make sure it's coordinated with your overall plan and that you're making a decision that is going to work with you given all the different factors. Like you have enough money, enough resources that it's not going to put your retirement at risk. Now, if you have questions or you feel a little overwhelmed, you can go to themillionaireinsider.com/support to get support and to have someone help you with some of your major retirement planning so that you're making the best possible decisions for your situation. On that note, I want to thank you so much for joining me. I'm Annette Ba'u. All international copyrights are reserved. Bye for now.